age. We all know that age affects us, but is it really so? We know that we cannot reverse our age, but is it possible to reverse the effect of age on our reproductive system? This and many other doubts, suggestions, we just want to discuss each and everything related to age and fertility with Dr. Vinuta. She has a very, we can say that she has very good results with Fertility Dost members, and along with Khushi Fertility, we have very success stories, many success stories which we can discuss, and the list will just go on. So, Dr. Vinuta, let's start with the session and with the main topic: how does age affects fertility? We all know that when we just strike the clock at 35, there's some kind of tension, there's some kind of stress, that what next? So is it really so that age affects our fertility?
Yeah, definitely age affects our fertility because fertility is related to age. And in today's society, we have seen that infertility is becoming on a rise because of various reasons, like women are more career oriented because of education, and also like they're delaying their marriage, and uh, and also the motherhood. So that is the reason we are seeing more and more women are coming in 40s for fertility treatment. So why do I say age affects infertility? Because basically, we have to go back to our biological clock. We have to remember women's biological clock, because all women are born with certain amount of eggs. See, this is physiological and it is genetically predetermined. So when she is born, maybe around a few millions of eggs are there in the ovaries, and by the time she reaches her puberty, there are around a few lakhs. So from the time she's born to puberty, there are so many eggs which are depleted and which are wasted. So this is more physiological. Then once she reaches her reproductive, that is once she gets her puberty, we after that her that is the best period, that is around 20 to 30 years is the best period that she can conceive. That is a ideal period that she has to conceive. So once she attains a period, every month few eggs are depleted, maybe around thousands eggs are depleted. And by the time she reaches her 30, that is 30 plus years of age, she starts, there is a decline in the fertility, and more so there is a rapid decline after 35 years. And by 40 years the decline is more. So that is the reason. Why do I say this? Because when you take a woman at the age of 30 years, when she tries to conceive, she has 30% chance of getting pregnant in a single cycle. But when you take a woman at 40 years of age, that 30% falls down to 5%. So that is the reason I strongly say that age affects fertility. And I've just spoken about the women. Even male also have the similar problem, but though it is not so rapid, men also start having their fall in fertility by the age of 40 years, but it is at the slower pace. So even yeah, that's the reason I say for both male and female, age is an important factor.
Right. And again, if you are thinking or if you are planning your family and you are just nearing 35, 36, then we would suggest that please think of it on a much faster pace, because biological clock is ticking, your ovaries are also aging along with your age. Dr. Vinuta, usually nowadays we have a good variation in AMH values. Even the ladies in late 20s, they are also suffering from this low ovarian reserve or very low values of AMH. What could be the reason for this, and any special kind of treatment according to you for such ladies who are suffering from low AMH?
Yeah, first, let's talk about what is AMH. AMH means anti-Mullerian hormone. So it basically reflects the amount of ovarian reserve that a woman has in the ovary. So this is a blood test. that is which is done in various methods. So what I feel is AMH can go wrong if it is not taken in a taken the blood is not taken properly and it is not transported to the lab properly. So there could be variation in the lab to lab also. So what I believe is it is just a number, that's all. But if the AMH is low, I do call the patient on the second day of the menses to know what is their baseline follicular reserve. So what I believe is seeing is believing. So when I do a scan, when I put a probe, vaginal probe into the vagina, into the women's vagina, which is at high frequency, which is more close to the ovary. So I have a better vision of the ovaries, whether they are small in volume, how do they look, and whether how many follicles are there. So that gives me a better picture. So I suggest that women should not get panic when the AMH is low. They have to consult a proper fertility specialist. Also, there could be various reasons why AMH can be low. Even at 20 years, there are so many conditions where AMH can be low, especially something called as a premature ovarian failure, where a
Mhm.
woman has a normal pool, but she will be depleting the reserve very fast. And in another situation where the pool may be small, but it will be depleting at a normal range. So these two problems can be there. And there's one more reason where if she has undergone endometriosis or if she has undergone chemotherapy, radiotherapy. So these are the few reasons where the AMH level can be low. So such women should not panic, and I would say like coming to numbers, because women are more familiar with numbers. So I would say anywhere between 2 to 4 is normal, and 1 to 2 is reduced AMH, and less than 1 is more poor reserve, and above 4 they are what we say is they can respond, they can hyper respond.
Right. So, Dr. Vinita, is it really possible that AMH falls very rapidly? Because at times we have seen cases where ladies discuss that last month the values are more than one, and after a month, or we can say within a month, it just less than one. So, is it really possible that in normal circumstances the values reduced at one go? Or it's just a kind of myth?
Generally, what they say, the rate of decline of AMH for less than 35 years, they say it can decline up to 1 nanogram per year. It is per year. And after 35 years, it falls, the rate of decline of AMH is zero point 0.1 nanogram. So generally, I told you if they have associated with any other disease, like endometriosis is the most horrible. I mean, I can tell you most serious disease where it can affect the AMH value. So I would suggest all women who undergo any surgeries, ovarian surgery, should check their AMH before going surgery, before doing any surgery, so that we can take meticulous precautions when doing surgery, that so that the ovarian stroma is preserved, only the cysts are removed. So that's the reason it's very important to do an AMH level before any surgeries.
Right. So, as doctor just mentioned about endometriosis, and we think there are many cases today. We are seeing many women suffering from endometriosis. So, viewers, if you are having endometriotic cyst or such any such condition, then please take a note that you really need to think fast about your ovaries, because endometriosis is the main cause for depletion, or we can say that drastic fall of AMH. Dr. Vinuta, what you suggest for such females if they have less than one AMH values? Usually, people panic and they thought that donor cycle is the only option for me. So, what you suggest, like what are the new technologies or new procedures which can help such ladies?
So if I mean, I would on and generally what I would tell women is, if they are less than 35 and their AMH level is normal, if they're not planning pregnancy in near future, I would ask them to do their AMH level at least yearly once to see where they're heading to. And if they're above 35 years and if the AMH level is low, then that means that it's an alert, it's an alarm, like it's an alarm saying that they should take treatment and they should consult a fertility specialist and see where they're standing. That means they should go in a process of treatment. That means they should consider pregnancy and not postpone pregnancy. So if the AMH is low, then that doesn't mean that she can't, she's unable to conceive. Um, it just says that if we do a scan on the day two, if we find two ovaries on, two follicles on either side, there are medications, newer medications where we can give them to produce good follicles and mature follicles, follicles, and we have seen pregnancies in such women also. So there is no need to panic, but again, there is nothing that they should relax or anything, but they should go ahead and take further treatment.
Right. So, doctor, as we have many new procedures, we as a doctor, you must be doing new procedures, and the very new in this term we can say is uh, egg freezing. So, what
Mhm.
is the right age to freeze eggs? Embryo freezing, we know that it's really common, and whenever we go for